Welcome to Slocum Center for Orthopedics and Sports Medicine. My name is Dr. Koester, and I specialize in musculoskeletal injuries, concussion management, and pediatric and adolescent sports medicine. In this video, we will be discussing sports-related concussions. There's a lot of definitions for what a concussion is. The best definition is that it's a traumatic alteration in brain function, which means a blow to the head, a blow to the body, the head hitting the ground or hitting another head interrupts the way the brain works. You're not able to think the same, you're not able to process information the same. It affects everything that the brain is able to do in both receiving, processing, and transmitting information. And an important thing to think about also is that it doesn't require a loss of consciousness or being knocked out. That was one of the common thoughts years ago, but now we know that you can have a concussion, no need for being knocked out or having a loss of consciousness. In fact, that really occurs just a small percentage of the time. So symptoms of a concussion can be really varied, and the difficult part is that they don't always have to come on immediately. So an athlete may feel initial onset of dizziness or headache or nauseousness. Headache is the most common, but that doesn't always come on right away. In fact, sometimes kids will maybe just feel just a bit off after being tackled or having a collision, and things really don't start to blossom or develop for several hours. Sometimes it can be a day or so. Arriving at school the next day to the busy hallway and bells going off and people talking, that can really kick off symptoms at that point. Signs of concussion are things that you may witness as a parent or as a coach. With that, we're looking for kind of that glassy-eyed look, or what's called the deer in the headlights stare, where you can tell that the person just really isn't there and able to concentrate and focus. Also looking for things like wobbliness as walking around, having difficulty keeping their balance, and looking for things like that they're just not able to pay attention, or perhaps in a game or a practice not doing their assignment or the drill correctly. If you think your child has a concussion, the most important thing is to make sure that they don't continue to participate in that game, that practice, or even running around and playing that day, or if you're skiing or biking or doing some other physical activity. The concern is that they continue to do that same physical activity. Number one, they're at risk for getting another blow to the head, which certainly can make symptoms and make the injury worse, but they're also at risk for just further irritating those symptoms, further making the brain unable to begin the healing process as quickly. Invariably, the concussions that I see where the symptoms last the longest, almost always it involves that there was another blow to the head, another blow to the body, or the person continued participating in the game or the practice, or didn't report their concussion symptoms for several days. So I just can't emphasize enough the importance of, once you think a concussion has occurred, getting that person out of activity and then getting them to see either the urgent care or emergency department or their primary care physician and getting them evaluated. And again, when we look at that, it's even if you think they had a concussion. We're not looking for parents or coaches to make the diagnosis of concussion, but if you suspect it, then the mantra really is, when in doubt, sit them out. Length of symptoms of a concussion can vary greatly from person to person. We can see people who have symptoms that last for only 10, 15, 20 minutes in some cases. Unfortunately, I've had patients who have had symptoms last up to a year or longer. Now, there's a lot of space there in between, and on average, we see symptoms resolve within about 2 to 3 weeks. Now, that doesn't mean that everybody resolves in that time frame. There's people on both ends of it. Average 2 to 3 weeks, but very, very difficult to predict. There are some studies that have come out, depending upon how poorly people score initially on the impact test, depending upon symptoms like dizziness at the time of injury. That may portend a little longer course, but for the most part, almost impossible to predict the length of injury outside of those broad parameters.